What is cholesterol and why should we care? Cholesterol, in essence, is a waxy substance that our bodies naturally produce. It's not inherently bad. In fact, it plays a vital role in the creation of hormones, the synthesis of vitamin D, and the production of substances that aid in food digestion. However, it's a delicate balance. Our bodies generate all the cholesterol we need, but when we consume too much of it through our diet, that's where the problems can start to creep in. Picture it like a seesaw. Too much on one side and everything becomes unbalanced. It's the same with cholesterol. An overabundance can lead to an array of health issues, including the clogging of arteries, which is a significant risk factor for heart disease. So, while cholesterol is essential for our body, an excess can be problematic. But how do you know if you have high cholesterol? This might be a question you've asked yourself, and it's a crucial one. High cholesterol often quietly wreaks havoc on the body, without displaying any overt symptoms until it's too late. However, there are some subtle signs that could indicate high cholesterol levels. Firstly, chest pain or angina can be a significant indicator. This discomfort may feel like a pressure or a squeezing sensation in your chest. It's often mistaken for heartburn or the effects of indigestion, but it's important to not dismiss this symptom. Secondly, heart palpitations or the feeling that your heart is skipping a beat or fluttering can also be a sign. This irregular heartbeat might be accompanied by a sense of panic or anxiety. Thirdly, fatigue or a constant feeling of tiredness or exhaustion can be another symptom. Despite adequate sleep or rest, you might still feel drained or lack energy. Fourthly, shortness of breath is another symptom to look out for. You might find yourself gasping for air or struggling to breathe, especially after physical exertion. Lastly, dizziness or lightheadedness can be another subtle sign of high cholesterol. You might feel unsteady, lose your balance, or feel like you're about to faint. However, it's important to remember that these symptoms often do not appear until a person has severe heart disease or a heart attack. Therefore, it's essential to regularly get your cholesterol levels checked. What causes high cholesterol levels in the first place? It's a question that has puzzled many, but science has shed some light on it. Let's delve into 5 key causes of high cholesterol. First off, there's poor diet. Consuming foods high in saturated fats and cholesterol, such as red meat and full-fat dairy products, can raise your cholesterol levels. Even trans fats found in many fried foods and baked goods can increase your cholesterol. Secondly, obesity is a significant contributor. Having a body mass index of 30 or higher often correlates with high levels of bad cholesterol, or LDL, and low levels of good cholesterol, or HDL. Thirdly, lack of exercise can be a culprit. Regular physical activity can help raise HDL cholesterol while lowering LDL cholesterol. Without it, you might find your cholesterol levels creeping up. Fourthly, smoking is a big no-no. It can lower your good cholesterol, particularly in women, and increase your bad cholesterol. The chemicals in tobacco smoke can damage the walls of your blood vessels, making them more prone to accumulate fatty deposits. Lastly, genetics play a role too. If your family has a history of high cholesterol, you may be at a higher risk. It's called familial hypercholesterolemia, and it can lead to very high cholesterol levels at a young age. Understanding these causes can help us prevent high cholesterol. So let's take charge of our health by addressing these factors and maintaining a balanced lifestyle. What happens if high cholesterol isn't addressed? This is a question we should all be asking ourselves. High cholesterol, when left unchecked, can lead to a myriad of health complications that can drastically impact our lives in the long run. The first complication we'll discuss is atherosclerosis. Atherosclerosis develops when cholesterol and other substances in your blood begin to build up on the walls of your arteries. This buildup, often referred to as plaque, can narrow your arteries and limit blood flow, potentially leading to serious heart complications. Next, we come to heart disease, one of the major concerns linked to high cholesterol. High levels of low-density lipoprotein or bad cholesterol can cause a buildup in the arteries that supply blood to your heart, limiting its oxygen supply. This can lead to chest pain, heart attacks, or even heart failure. Thirdly, we have stroke, a condition that occurs when a blood clot or a buildup of plaque blocks blood flow to your brain. High cholesterol can contribute to the formation of these clots or plaques, making it a significant risk factor for stroke. The fourth complication is peripheral arterial disease, a condition characterized by narrowed arteries reducing blood flow to your limbs. High cholesterol can contribute to the buildup of plaque in these arteries, leading to symptoms like leg pain when walking. Finally, we have diabetes. While it may seem unrelated, research has shown that high cholesterol can negatively affect your body's ability to regulate blood sugar levels, potentially leading to type 2 diabetes. So, what does this mean for us? It means that we need to take high cholesterol seriously. It's not just about numbers on a medical report, it's about preventing these potentially life-altering complications. It's about safeguarding our health and ensuring we can lead long, fulfilling lives. The complications of high cholesterol are far-reaching and severe, but remember, they're not inevitable. With awareness, early detection, and proper management, we can mitigate these risks. As you can see, high cholesterol can lead to a slew of health issues. Let's strive to keep our cholesterol in check and maintain our health for years to come. So, how can we prevent high cholesterol? Well, the first step is maintaining a healthy diet. This means incorporating more fruits, vegetables, and whole grains into your meals, while reducing your intake of saturated fats, trans fats, and cholesterol-rich foods. It's not just about cutting out the bad stuff, but also adding in the good. Next, engaging in regular physical activity is crucial. Exercise helps raise the levels of good cholesterol in your body, while lowering the bad. Aim for at least 30 minutes of moderate intensity exercise most days of the week. It doesn't have to be a strenuous gym session. Even a brisk walk can do wonders. If you're a smoker, quitting is a must. Smoking lowers the level of good cholesterol in your body, making it more susceptible to the harmful effects of the bad cholesterol. It's never too late to quit, and the benefits begin immediately after you stop. Limiting alcohol intake is another effective prevention method. While moderate alcohol use can potentially have heart benefits, excessive drinking can lead to high cholesterol and other health problems. It's all about balance and moderation. Finally, regular health checkups are essential in preventing high cholesterol. These checkups can help you keep track of your cholesterol levels and make necessary adjustments to your lifestyle or medication. Adopting these lifestyle habits can significantly reduce your risk of high cholesterol. Prevention is always better than cure, and with these strategies, you're taking proactive steps towards a healthier life. But what if you already have high cholesterol? What can you do then? Well, the good news is that high cholesterol can be managed, and there are 5 key ways to do this. Firstly, medication may be prescribed by your doctor. This can include statins, bile acid-binding resins, cholesterol absorption inhibitors, or even a combination of these. It's crucial to always follow the doctor's instructions and never self-medicate. Secondly, lifestyle changes are in order. This means getting regular exercise, stopping smoking if you do, and limiting alcohol intake. These changes can significantly lower your cholesterol levels and improve your overall health. The third treatment is weight management. Losing even a few pounds can help lower cholesterol. So consider a balanced diet and regular exercise to maintain a healthy weight. Next, dietary changes are key. Avoid saturated fats, and trans fats often present in processed foods. Opt instead for healthier fats from lean meats, low-fat dairy, and plant-based sources. Also, include plenty of fruits, vegetables, and whole grains in your diet. Finally, regular monitoring of cholesterol levels is essential. Regular checkups with your doctor will ensure that your treatment plan is working and can be adjusted if necessary. Remember, managing high cholesterol is a lifelong commitment, not a one-time effort. So take it one step at a time and stay proactive in maintaining your health. So we've learned a lot about cholesterol today. We've discovered that cholesterol is a waxy substance, vital to our body's functioning. We've identified its symptoms and understood the various causes that can lead to high cholesterol levels. We've also delved into the potential complications and learned about the preventive measures and treatment options. With this knowledge, we can be proactive about our health and manage our cholesterol levels effectively.